Hello everyone, now let us discuss about CPT coding guidelines for surgery, musculoskeletal system, part 3D. In the current session, we will be focusing on CPTs of spine deformity, exploration and spinal instrumentation. Coming to spine deformity. To report instrumentation procedure codes, you need to report or see 22840 to 22855 series and additionally 22859. One more important point is do not append 62 modifier to spinal instrumentation codes. And also 62 modifier should not be appended to bone graft procedures. Now what is a vertebral segment? A vertebral segment describes the basic constituent part into which the spine may be divided. Vertebral segment describes the basic constituent part into which a spine may be divided. It represents a single complete vertebral bone. Vertebral segment represents a single complete vertebral bone and its associated articular processes and laminae. And for the following codes, when two surgeons, that is for spine deformity codes, when two surgeons work together as primary surgeons performing distinct part of orthodesis for spinal deformity, each surgeon should report his or her distinct operative work by appending 62 modifier. In this situation, 62 modifier may be appended to procedure codes as well as the add-on codes as long as the both surgeons continue to work together as primary surgeon. And the spinal deformity orthodesis codes which come under the range 22800, 22802, 804, 808, 810 and 812 and the kyphectomy codes 22818 and 22819 should not be reported in conjunction with vertebral body tethering codes 06560 and 06570. Spinal deformity orthodesis codes and kyphectomy codes should not be reported in conjunction with vertebral body tethering codes. Now coming to the CPTs of spine deformity, 22800. The first CPT is 22800. It is nothing but orthodesis posterior for spine deformity with or without cast up to 6 vertebral segments. From 7 to 12 vertebral segments, you need to report 22802 and for 13 or more vertebral segments, you need to report 22804. Next code is 22808. Orthodesis anterior for spine deformity with or without cast 2 to 3 vertebral segments. And from 4 to 7 vertebral segments, you need to report 22810. And for 8 or more vertebral segments, you need to report 22812. The next code is 22818. Kyphectomy, circumferential exposure of spine and resection of vertebral segment, including body and posterior elements, single or two elements. Kyphectomy can be reported by 22818. Kyphectomy, circumferential exposure of spine and resection of vertebral segment, single or two elements. If 3 or more elements are involved, you need to report 22819 for kyphectomy codes. Now let us discuss an example. Mr. Smith underwent an orthodesis of her spine for spinal deformity, posterior approach, segments L3 to L5. How is this orthodesis coded? The appropriate code is 22800. Orthodesis posterior for spinal deformity with or without cast up to 6 vertebrae. Because the vertebrae are less than 6 in number, you are using this code for this particular example. For vertebrae L3 to L5, you use 22800. Coming to spinal exploration. Whenever instrumentation codes are coded or reported in conjunction with code for definitive procedures, when instrumentation reinsertion or removal is reported in conjunction with other definitive procedures, including orthodesis, decompression, and exploration of fusion, you need to append 51 modifier to 22849, 22850, 22852 and 22855 codes. And the codes 22849 should not be reported with 22850, 852 and 855 at the same spinal levels. And to report exploration of fusion, you need to code 22830. And whenever spinal exploration is done in conjunction with other definitive procedures, including orthodesis, decompression, you need to append 51 modifier to 22830. So the only CPT of spinal exploration is 22830, which is nothing but exploration of spinal fusion, any region. Coming to spinal instrumentation. So what is segmental instrumentation? Segmental instrumentation is defined as fixation at each end of the construct and at least one additional interposed bony attachment. Segmental instrumentation is defined as fixation at each end of the construct and at least one additional interposed bony attachment. And non-segmental instrumentation is defined as fixation at each end of the construct and may span several vertebral segments without attaching to intervening segments. Instrumentation is of two types, segmental and non-segmental. Here you can see the definitions of segmental instrumentation and non-segmental instrumentation. Insertion of spinal instrumentation is reported separately and in addition to orthodesis. Instrumentation procedure codes which come under the range 22840, 22848, 22853, 854, 859 are reported in addition to definitive procedure. And one more important point is do not append 62 modifier to spinal instrumentation codes. And similarly, you need not append 62 modifier for bone graft codes also, which come under the range 20938 to 20930 to 20938. And a vertebral segment is described as the basic constituent part in which a spine may be divided. Vertebral segment represents a single complete vertebral bone with its associated articular processes and laminae. Vertebral interspace is a non-bony compartment between two adjacent vertebral bodies which contain the intervertebral discs and includes the nucleus pulposus, annulus fibrosus and two cartilaginous end plates. So coming to the instrumentation codes 22849, 850, 852 and 855 are subjected to modifier 51 if reported with other definitive procedures including orthodesis, decompression and exploration of fusion. And code 22849 should not be reported in conjunction with 22850, 852 and 855 at the same spinal level. So these are some of the guidelines for spinal instrumentation. Basic guideline is 62 modifiers should not be appended for instrumentation codes. And whenever other definitive procedures like orthodesis, decompression and exploration of fusion are performed, along with spinal instrumentation, you need to append 51 modifier. Only the appropriate insertion code which come under the range 22840 to 22848 should be reported when previously placed spinal instrumentation is being reported or revised during the same session with new instrumentation is inserted at levels including all or part of the previously instrumented segment. In simple words, if the patient has been placed with spinal instrumentation previously, only appropriate insertion code should be reported whenever previously placed spinal instrumentation code is being removed or revised during the same session when new instrumentation is inserted at levels including all or part of the previously instrumented segments. Another important point is do not report the reinsertion, which is nothing but 22849 or removal codes 22850, 852, 855 procedures in addition to insertion of new instrumentation codes which come under the range 22840 to 22848. You should not report the reinsertion or removal codes, procedure codes, in addition to insertion of new instrumentation codes. Coming to the CPTs of spinal instrumentations, the first CPT is plus 22840. This is nothing but posterior non-segmental instrumentation. Example, Harrington rod technique, pedicel fixation across one interspace, atlantoaxial transarticular screw fixation, sublaminar wiring at C1, facet screw fixation. The next is 22841. This is also add-on code. Previous 22840 is also an add-on code. Now coming to 22841, it is internal spinal fixation by wiring of spinous process. The next is 22842. Posterior segmental instrumentation. Example, pedicel fixation, dual rods with multiple hooks and sublaminar wires. 3 to 6 vertebral segments. The next code is 22843. For 7 to 12 vertebral segments, you need to report 22843. And for 13 or more vertebral segments, you need to report 22844. And for anterior instrumentation, 2 to 3 vertebral segments, you need to report 22845. And for vertebrae 4 to 7 vertebral segments, you need to report anterior instrumentation of 4 to 7 vertebral segments. You need to report it with add-on code plus 22846. And for 8 or more vertebral segments, you need to report with 22847. The next is 22848, pelvic fixation. Attachment of caudal end of instrumentation to pelvic bony structures other than sacrum. Pelvic fixation is nothing but attachment of caudal end of instrumentation to pelvic bony structures other than sacrum. This is reported by 22848. The next code is 22849, which is nothing but reinsertion of spinal fixation device. The next code is 22850, removal of posterior non-segmental instrumentation. Removal of posterior non-segmental instrumentation, example, Harrington rod. Whenever Harrington rod is removed, you need to report 22850. The next is 22852, removal of posterior segmental instrumentation. The next is add-on code plus 22853, which is nothing but insertion of interbody biomechanical device, example, synthetic cage or mesh with integral anterior instrumentation for device anchoring. Example, screws and flanks when performed to intervertebral disc space in conjunction with interbody orthodesis, each interspace. This code must be used in conjunction with interbody orthodesis. Next is plus 22854, insertion of intervertebral biomechanical device, example, synthetic cage or mesh with integral anterior instrumentation for device anchoring when performed to vertebral corpectomy. Defect in conjunction with interbody orthodesis, each contiguous defect. The next is an out of numerical sequence code plus 22859, which is nothing but insertion of intervertebral biomechanical device, example, synthetic cage, mesh, methyl methacrylate to intervertebral disc space or vertebral body defect without intervertebral orthodesis, each contiguous defect. The next code is 22855, removal of anterior instrumentation. The next is 22856, total disc orthoplasty. Artificial disc anterior approach includes discectomy with end plate preparation. Includes osteophytectomy for nerve root or spinal decompression or microdissection, single interspace cervical. Total disc orthoplasty anterior approach, including discectomy with end plate preparation, single interspace cervical, is given by 22856. The next code is add-on code and out of numerical sequence code 22858. For second level cervical region, you need to use this add-on code for the previous code. The next is 22875. Total disc orthoplasty anterior approach, including discectomy to prepare interspace, single interspace lumbar. The next is 22861. Revision including replacement of total disc orthoplasty, anterior approach, single interspace cervical. Revision including replacement of total disc orthoplasty, single interspace lumbar is given by 22862. The next is 22864. Removal of total disc orthoplasty, anterior approach, single interspace cervical. Next is 22865. Removal of total disc orthoplasty, anterior approach, single interspace lumbar is given by 22865. The next is 22867, which is nothing but insertion of interlaminar or interspinous process stabilization distraction device without fusion, including image guidance when performed with open decompression, lumbar, single level. And for second level, you need to report add-on code plus 22868. The next code is 22869. Insertion of interlaminar or interspinous process stabilization or distraction device without open decompression or fusion, including image guidance when performed, lumbar, single level. The next is add-on code 22870, lumbar, second level. Next is 22899, unlisted procedure, spine. Now let us see an example. A 55-year-old male suffering from DJD at L4 to L5 and L5 to S1 was placed under general anesthesia. A lower quadrant incision was made in a transverse fashion and was carried down to anterior rectus sheath. The anterior rectus sheath was divided and circumferentially the rectus muscle was mobilized and separated from the posterior rectus sheath. And the L5 to S1 disc space was exposed. Using Cutmer, and we divided the medial and sacral veins and used blunt dissection to clean the disc space. Then sized and trailed. Further disc material was removed. A bilateral discectomy was performed. And here discectomy is also performed. Fine and end plates were implanted. Excellent placement was noted regarding the insertion of Cherite's artificial disc at L5 to S1. And the area was inspected and there was no compression of any nerve root. Peritoneum was then allowed to return to normal anatomical position and the entire area was copiously irrigated. The wound was closed in a layer fashion. Select the appropriate procedure code. Here person was suffering from DJD and a total disc orthoplasty was performed using anterior approach. So the appropriate code is 22857, total disc orthoplasty. Anterior approach including discectomy to prepare interspace other than for decompression, single interspace lumbar. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.